Myth number 25. Ulcers are caused primarily or entirely by stress. I'm just going to start off with some initial questions for you. These should already be posted within the discussion box if you would like to respond to them. Most of us have been in many stressful situations throughout our lives. Have you ever stopped and thought about how stress can be affecting your body? If so, in what way have you noticed the stress affecting you? What are ulcers? Peptic ulcers are the sores in the lining of the stomach or small intestines. In the 1980s, most physicians were convinced that stress was the main cause of ulcers. Factors that played an important secondary role include spicy foods, excess stomach acid, smoking, and alcohol consumption. Barry Marshall and Robin Warren paved the way by groundbreaking research that radically changed our thinking about ulcers and their treatment. Marshall and Warren were the first to discover that H. pylori infection is seen throughout those with ulcers and uncommon in those without ulcers. Only about 10% to 15% of people develop ulcers. An independent researcher from across the world established that treating the H. pylori infection with strong antibiotics would reduce the reoccurrence of ulcers dramatically. The reoccurrence of ulcers decreased by 90% to 95%. Antibiotics are important because drugs that simply neutralize stomach acid can effectively treat ulcers in some cases. However, 50% to 90% of ulcers reoccur after treatment stops. How stress affects ulcers. In 1996, Thomas Gilovich and Kenneth Savitsky noted the belief that stress causes ulcers may be branched from a misuse of the representativeness heuristic. Stress is often known to make you feel nauseous, and it seems reasonable to believe that it can also cause other stomach problems as well, such as ulcers. Around 25 million Americans of all socioeconomic stripes will suffer the distressing pain of ulcers during their lifetime. By 1997, 57% of Americans still believed that stress was the main cause of ulcers. 17% believe that spicy foods was the cause. Stress is seen to be linked to a poor response to ulcer treatment, and stressful events are associated with the increase in ulcers. Just like I stated in the initial question slide, stressful events can affect our bodies in many ways, in ways that we might not even notice. Those with generalized anxiety disorders are often at a higher risk for peptic ulcers. Stress may contribute to the development of ulcers in terms of a biopsychosocial perspective. Medical conditions depend on the complex interactions of genes, lifestyles, immunity, and everyday stressors. Stress may apply an indirect effect on the development of ulcers by causing such behavior as alcohol use and lack of sleep, which makes ulcers more prone. Stress plays an important role in ulcer formation. However, it's clear that stress is not the only or even most important influence. Probability that stress, emotion, and the damage shaped by disease-producing organisms combine to create conditions ripe for the growth of H. pylori. These are the final questions that I have for you, and they'll also be in the discussion box if you would like to answer them. Have you ever heard of this myth before this presentation? Did you know what ulcers were before this? What was the most surprising thing you learned throughout this presentation? Do you believe this myth is true? Why or why not? Then lastly, this is my works cited page. Thank you guys for listening.